Hi everyone, today's headlines. Health Department issues guidelines to augment human resources for COVID-19. All activities and movement of persons suspended. Government issues total lockdown guidelines. CVYS apologized for assault on minor boys in Chimukuduma. NPF urges state government to ramp up infrastructure in all district designated hospitals. Nagaland reports 269 COVID-19 positive cases and 5 deaths on May 11th. Oxygen plant installation at NHAK completed. Bharat Biotech Covaxin get approval for 2 to 3 trials on 2 to 18 years old. News in details. Health Department issues guidelines to augment human resources for COVID-19. The Principal Directorate of Health and Family Welfare Department, Dr. Nekrili Kimino, issued guidelines for mobilized trained human resources for effective management of COVID-19 pandemic in the state. The PD informed that students of GNM or BSc Nursing and allied healthcare professionals courses who are undergoing internship or are in final year awaiting final exam may be given full-time non-COVID essential services duties at government or private facilities under the supervision of senior faculty. The existing medical staff, wherever thus relieved of non-COVID essential services duties, should be deployed for COVID-19 duties. The order also said that students of A&M courses who are undergoing intern or are in final year awaiting final exam may be given full-time COVID vaccination nursing duty at government or private facility under the supervision of senior faculty. The existing medical staff, wherever thus relieved of non-COVID essential services duties, should be deployed for COVID-19 duties. All activities and movement of persons suspended. Government issued total lockdown guidelines. To contain the surge of COVID-19 pandemic and to break the chain of spreading the disease, Nagaland government on Tuesday decided to impose a week-long total lockdown across the state of Nagaland with effect from 6 p.m. on May 14 to May 21, 2021. The decision was taken during an emergency meeting of high-powered committee on COVID-19 held on Tuesday morning at the Chief Minister Residential Complex, Kohima. Following the decision to impose total lockdown in the state of Nagaland, Chief Secretary J. Alam IS issued fresh guidelines for the lockdown. CVYS apologized for assault on minor boys in Chimukuduma. The Chimukuduma Village Youth Society on Tuesday tendered unconditional apology to the victim family for physical assault by some youth members at Chimukuduma Village on May 6, 2021. The Chimukuduma Village Youth Society President and General Secretary stated, with utmost regret, CVYS tender unconditional apology to the victim family for the unfortunate incident on the fateful evening of 6 May 2021 at Chimukuduma Village, wherein some youth members have physically assaulted 2 minors. The CVYS also expressed its sincere regret for the unfortunate turn of events where the victim was grievously injured and had to be hospitalized due to the assault. The CVYS further convey its unconditional apology and also pray for a speedy recovery. NPF urges state government to ramp up infrastructure in all district designated hospitals. The NPF Legislative Party said that though total lockdown should be the last resort of the government, looking at the indifferent attitude and the alarming rising positive cases in Kohima district, the only option left to protect the people would be for a total lockdown in these 2 districts. It also added that during trying times such as these, the government of the day should be more proactive to tend to the needs and listen to the cries of the people rather than amassing wealth. The NPF stated it is persuaded at the mishandling and unpreparedness of the PDA government in handling the rising COVID-19 cases in the state. This government seems to have learned nothing from the first wave which we have all faced last year. The excuse that other developed nations and Indian states are also finding it difficult to contain this virus should no longer be parroted by the government as a result of its own inefficiency, the party said. Nagaland reports 269 COVID-19 positive cases and 5 deaths on May 11. Nagaland reported 268 COVID-19 positive cases on Monday, May 11, 2021 in Nagaland. The state total tally rose to 16,552, updated the Health Minister S. Pangifom. Out of 269 new COVID-19 positive cases reported, 207 cases were detected in Dimapur, 40 in Kohima, 8 in Tunsang, 4 each in Moguchung and Mon, 3 in Pekan, 1 each in Longlang, Zunabato and Peren. Active cases stands at 3081. Also, the state recorded 45 recoveries of COVID-19 patients, taking the total recovery tally in the state to 12,779, updated the Health Minister S. Pangiform. Out of 45 recoveries yesterday, 31 patients recovered from Dimapur, 10 from Kohima, 4 from Longlang. The Health Minister updated. The state also reported 145 deaths of COVID-19 till date, the Health Minister informed. Oxygen plant installation at NHAK completed. The installation of the much-needed pressure swing adsorption oxygen generation plant at Naga Hospital Authority Kohima has been completed and it will be ready to use once the samples sent for certification on Tuesday returned from a government-approved laboratory based in New Delhi. Nilanjan, service engineer from Abstent Technologies who was working at the installation site, confirmed this to news agency on Tuesday. The oxygen generation plant is ready to use, but we are waiting for the lab report, he informed. Bharat Biotech Covaxin gets approval for next phase of trial on 2 to 18 years old. An expert panel on Tuesday recommended Bharat Biotech's COVID-19 vaccine Covaxin for phase 2 to 3 clinical trials on those aged between 2 to 18 years. The Subject Expert Committee on COVID-19 of the Central Drug Standard Control Organization took the decision after the Hyderabad-based Bharat Biotech sought permission to conduct phase 2 to 3 clinical trials to evaluate the safety, reactogenicity and immunogenicity of Covaxin jabs in children aged 2 to 18 years. That's all for now. To get us latest news, don't forget to subscribe this channel. Thank you.